We have had two cases. These are two women from the same family, one in her 30s, one in her 40s, who recently arrived here from the United Kingdom. Both women arrived in New Zealand together on the 7th of June and stayed in a managed isolation hotel in Auckland, and were permitted on compassionate grounds to leave managed isolation to travel to Wellington via private vehicle on 13 June. There was an agreed plan in place as part of the approval process for the compassionate exemption, and that included for the travel arrangements. So they had a private vehicle dropped to the hotel. They then drove together all the way to Wellington and had no contact with anybody else during that trip. And they didn't use any public facilities, and they also have been just with a single family member since they arrived in the Wellington region. They both had testing done at the Wellington Community-Based Assessment Centre as part of their agreed self-isolation plan. I should say that that was one of the drive-through centres here, and that of course those doing the swabbing were using full PPE. Now, following the positive result being notified this morning, local public health staff are testing and isolating all others who may be at risk of exposure. As I said, in this case, it is just the one additional family member. Other potential contacts include people on the same flight from Brisbane and people who are in or who have been in the same managed isolation facility in Auckland, including staff. Public health staff have also been in contact with their counterparts in Australia, so they can take appropriate action for any passengers who were on the same flight that the women took out of the UK via Doha and into Brisbane. And I can say now both women are self-isolating in the Wellington region, and we're very confident the arrangements that are in place is the best place for them to be right now.